The drugging of pregnant women has led to a 20 to 30% hazard of preterm birth, brain damage, and lower fetal age at delivery, and nearly triples the risk of severe birth defects.
And the antidepressants have been shown to cause something called PPHN, which is a heart problem in newborns. And I think it's criminal to be giving medications to women knowing that their babies are going to be at risk.
When mom takes Paxil, she can have a baby born with sometimes they have the limbs are missing. It's called limb reduction. Can have cleft lip. They can have serious heart defects, missing chambers, or the arteries in the wrong place, and also can be born with the organs growing outside of the body.
And these are just a few of the many, many side effects of psychotropic drugs. Among the top 3 best-selling antidepressant drugs, called SSRIs, there are 1,817 possible side effects associated with Prozac, 2,194 with Zoloft, and 2,497 with Paxil. Interestingly, among these is the worsening of the exact same symptoms the drugs claim to address.
They cause depression. They cause suicidal tendencies and ideologies. So they cause a lot of the very exact symptoms that they're supposed to be correcting.
They're being treated for depression with a product that's going to create depression. They're treating for a psychosis with something that's actually going to create or has the potential of creating a psychosis.
Atypical antipsychotics, one of the newest classes of psychotropic drugs, are used mainly on adults and children diagnosed with bipolar disorder. They are also known as mood stabilizers. Though launched with storied claims as miracle drugs with little or no side effects, atypical antipsychotics have recently been exposed as creating severe weight gain, diabetes, coronary heart disease, acutely irregular muscle movement, pancreatitis, and delirium. Though the new antipsychotics were originally approved only to treat schizophrenic adults, over a 7-year period, prescriptions for children jumped 5-fold to an estimated 2.5 million prescriptions. And this drugging is coming with serious consequences.
You know, I've seen kids who have had significant weight gain on some of the antipsychotics, where they were pre-diabetic. You know, they've had, changes in some of their cardiovascular functioning. So there are potentials to really damage the child's health.
When you get drugs that you're giving to kids that we know cause extreme weight gain and attack the liver, attack the kidney, that have long-term results, these children that we're giving them today, this medication, we may be doing, kidney dialysis for in 10, 15 years.
And it is not only children that can be affected. It has been estimated that psychotropic drugs are to blame for over 16,000 traffic accidents every year in the United States. And this study only looked at drivers 65 and older. And what happens when these unwanted side effects surface? Usually, the psychiatrist will prescribe yet another drug.
It's called polypharmacy. It's just, adding additional, if the first drug doesn't work, you add a second drug. If you have an adverse side effect from a drug, then you add another drug to deal with the adverse side effect.
And then let's say they start an antidepressant and now they can't sleep. So in order to counteract that, they'll be given a sleeping pill. Then a tolerance builds up. So they might now need another drug because they're now at a tolerance level of the first drug that it's no longer creating the, quote, expected or helpful result.
It's not uncommon to see people 5, 6, 8, 9, psychotropic drugs. And there's absolutely not a shred of research that supports that these drugs can be used safely and effectively in combination.
Consider tardive dyskinesia, a movement disorder entirely caused by psychotropic drugs. For 20 years, beginning in the 50s, psychiatrists failed to inform patients about the link between tardive dyskinesia and antipsychotics, such as Thorazine and Haldol. By the time psychiatrists admitted the truth about their pills, thousands had been permanently crippled. Even today, tardive dyskinesia has developed in 73,000 older adults, and drug-induced Parkinsonism has appeared in 61,000 more. But this class of psychotropics is far from the exception. Reports are now surfacing that today's atypical antipsychotics and antidepressants, such as Zoloft, are causing widespread tardive dyskinesia, sometimes within months of first use. But psychiatrists and drug companies continue to dispute this damning new evidence and go on prescribing these drugs, even to children. But of all the side effects experienced by users of psychotropic drugs, the most horrendous may be an intense inner agitation and restlessness known as akathisia.
These drugs can cause something called akathisia, which causes people to become very agitated and actually a little nuts, you know, a little off balance, and they'll do things that they never would have done before, things that are totally out of character.
This is a normal person without any history of auditory hallucinations, and all of a sudden they'll say there's voices telling them this is the only way to stop the pain, this is the only way is to kill themselves.
Had patients tell me that they never, ever, ever had one single thought about suicide in their entire life until they started on the drug.
An estimated 10 to 25% of SSRI antidepressant users, close to 7 million people in the U.S., experience akathisia. And Psychiatry's Diagnostic and Statistical Manual of Mental Disorders even admits the connection between psychotropic drugs, akathisia, and suicide. The statistics back this up. The suicide rate of the general population is less than 11 for every 100,000. But for every 100,000 people taking SSRIs, the suicide rate jumps to 718, over 65 times more. And yet, we are told daily by psychiatrists and drug companies that psychotropic drugs actually prevent suicide. So, what are we to believe? One can start with the drug company's own warning letters to doctors, or unpublished data for the antidepressant Effexor, or an analysis of Prozac using the FDA's own statistics, or even a British House of Commons report on Zyprexa. Of course, not everyone commits suicide, but the huge volume of other side effects can be horrendous.
The medication that the psychiatrist prescribed me made me feel awful. Constant headaches, constant nausea, wanting my skin to turn inside out, just feeling like bugs were crawling all over me all the time.
It made me feel like all slow and like sluggish and stuff. Like when somebody would ask me something, it would kind of like take a minute, like, what?
These drugs have affected my heart. They have affected my liver.
Weight gain one time, hit like 40 pounds.
These thoughts come over me like I wanted to kill I wanted to really hurt somebody.
It just sucks all the life out of you, so you're like a body, like a machine.
I didn't want to live. I didn't have the desire to live. I felt miserable.
You just can't live, you know, you'd just rather die. Because there's no living when you're hallucinating every day.
I actually tried to commit suicide with my psych meds.
At some point when you realize that you are really just existing, you're not living, at some point you realize you need to take the risk to get off.
But what about those who say psychotropic drugs really did make them feel better? That for them, these are life-saving medications whose benefits exceed their risks. Are psychotropics actually safe and effective for them?
So what ends up happening is that someone feels good for a while, and then very often they have to have their dose increased, and then they feel good for a while, and then they might have to have it increased again, or maybe they'll switch agents. So it's that kind of a story if you're not actually getting to the root of what's going on.
I think the research is pretty clear that then all of a sudden starts to change, and you start to have a supersensitivity to being depressed, in which case then they become more depressed, and then they're chronically depressed,